Hey, no.
Winners at the bar.
There's the man right there.
I'm back again. One more
Back
time.
again.
Recording that.
Yes.
Well, that's what needs to be decided.
Yeah.
So
you think it was funny?
They thought it was funny. You're the KKK one. The FFF club is the coolest one.
They should calm down. Scoot, I didn't mean to interrupt. I was just wondering, can I interview you? I put it online and try to get the word out there what we're doing. Sure. I'm just going to get pictures. How you doing?
Hi.
So why did you decide to come down tonight?
Well, my wife is under pressure at her job site. She's a healthcare worker, and there are several in her company. And since that's made us be involved, we've realized that there are lots of healthcare professionals out there who object to taking this so-called inoculation, this experimental gene therapy. And we realized that they're under a lot of pressure. And what group in the U.S. would know most about medicines and inoculations and vaccines and what's working and what isn't working than that group? And besides that, the education group in the United States that's the most resistant to getting this so-called vaccination is doctorates and PhDs. And that made us go like, wait a minute, what do they know that we don't know? We start looking around, and there's a lot of information out there, but it's not in the mainstream media. So a person has to dig. But it's coming to light, and it'll come more and more to light all the time. If this was a vaccine besides that, why would they be wanting boosters and then another booster? And there's a problem here, and people got to start waking up and paying attention. So that's why I'm here. I'm trying to wake up the people.
Where does your wife work? In Concord or around?
She works in the Stratford County area.
Okay.
Yeah, with visiting nurse, kind of our company. She's over there.
Oh, hi. So, do you want to also say why you came?
Yeah, basically my husband said the reason I'm here is to support the workers that are under tremendous stress. As a healthcare worker, I want to support my fellow colleagues, and we were here treating COVID patients back last year, and now all of a sudden we're the enemy. My boss wants to keep me, and I love my company, I love who I work for. And,
when is the date?
Well, it was October 1st because of the Maine mandate, but yesterday the Maine said that they were going to push it back to October 29th. So I say thank you, God, for the extra time, and we're moving forward. It gives us time to see what the judge will rule in the lawsuit against the governor. There's a lawsuit pending right now.
Oh, that's going to happen before October 31st?
Yes. So we'll see.
Would a court ruling change your mind?
They'll allow me to use my religious exemption.
But I'm saying if they don't allow you to use it, are you...
Oh no, then I leave my company.
Yes. Okay.
Yeah, my company knows that.
Yeah.
They've been really cool about it.
All right.
They're in a rock and a hard place, so.
Yeah, that's...
It's what it is.
All right, thank you for coming. Do you want to say why you coming?
Well, I'd say something. One thing.
Okay, sure.
The devil is a liar, a thief, and a murderer, and that's what's the spiritual war going on, and it's unfortunately we're all involved in it. It's time to stand up for truth.
Thank you.
Thank you.
He's back.
You're back. Second week.
Second week, and I'll do it again every week. Why? Because we need our freedom, and we don't need it taken away from us by anybody. It is what it is, and there's power in numbers, and it's going to work. Eventually, it will catch on, and there'll be more people at this corner, and there'll be other corners, and I'm sure it's happening across all of the United States. Because patriots do what they have to do to keep everything in line. Less government control.
Thank you.
You're welcome.
How are you doing, sir?
Pretty good, pretty good. Do you want to interview for a little video I'm putting together of the event?
Today?
Yeah, why you came, you signed, why you...
Well, we're just, I saw a Facebook video of Terese stepping out and, showing her disagreement on these mandates, and I just said I gotta go stand with her, and I think everybody that believes that should be out here and let everybody know how we believe, because if everybody stands up, they can't arrest all of us. It's like what Rand Paul said. Rand Paul said the same thing. He said it before I did. He said they can't arrest all of us. We don't want to wear the mask. Just don't wear the mask. The whole You don't have to take that vaccine.
Saying no is so much more powerful.
Yeah,
So much.
yeah. And just this one young lady did it, and she's caused. Look at all the crowds now. I was here last a week ago. I was here with her, and then this thing has gotten much bigger. So if you're out there and you believe this way, come on out. I don't know the times. Has she changed all the times, or is it still 11 to 1?
It's 11 to 1 Monday, Wednesday, Friday, but then Friday went an hour earlier because of the sun setting. You know, it gets dark by 7:10, 7:15.
So.
And there's a lot of people leaving work right now. So.
Yeah, that's why she wanted to be here. Which I think is a great idea.
It is a great idea.
We're hearing a lot of people come out. They're leaving work. They're honking their horns. You know, they're expressing their belief here as well. This is still America, and we can stand together.
I'm just glad. It seems the vast majority of people support it, so it definitely seems the tide has turned. And even a couple of weeks I've been coming here, so.
Well, a lot of people are finding out what's kind of going on. It's kind of a slow revelation to some people. Many people have still believed the mainstream media was telling them the truth and stuff, and now slowly but surely their friends are talking to them, and it's coming out that you know, I wouldn't buy a used car from Dr. Fauci. And anyway.
Anybody want to say where they came? Talk about their sign? No? Do you want to talk about your sign?
Who are you with?
I just put it on Rumble. Because they banned the last video on YouTube. Somebody talked about ivermectin.
Taboo.
Yeah.
Hi. Yeah, so I've been working frontline with COVID workers in the ER, a couple hospitals, and I work in a retail setting. And, you know, we were heroes, you know, which I thought was undeserved. It was just doing our job. However, most of the public called us heroes for simply being on the front lines. Thank you for your work, you're a hero. And yet now we're told we'll lose our job if we decide to make a medical decision about our own bodies. And so that's sad. So hence my sign. I think it really kind of is a slap in the face. But the other issue I have as a healthcare worker is for 32 years I've read drug studies. We have had it pounded into us, risk versus benefit. We support patients given the information that they need, making their own decisions. We're always told to have patients make their own decisions, and we're not being given that same right as a human being, and that is what is tragic here. That is what is wrong. It's not about being an anti-vaccine person. It's about not being given the same freedom to decide what we want to do with our body and make our own medical choices. And it's sad that a lot of us, you know, may lose our jobs because of it. It's a shame, but you know, I think if we don't stand up for this, we lose one freedom after another. It doesn't end here. It moves to vaccine passports, and it moves to many other things. And I think if we don't stand up, if you don't stand for something, you're just going to be following one mandate after another. Thank you.
I'm not. I'm coordinator.
I'm just curious. Are the nurses?
Do you guys want to talk about why you came, or your signs or anything? Do you want to interview for video and put together to the event? No? Okay.
No, do you, Alicia?
Do you want to? No.
Do you know that?
Do you guys want to interview for a video and putting together? Put it on Rumble. Last couple weeks we've been putting it out there, trying to get people to know what's going on. You're good?
Yeah, I'm good.
Okay. Do you want to say anything?
I'm just here to protest the mandate because this is still experimental. The approval has been false, FDA false approval for a name and not the actual vaccine. And the mandate, it's an experimental drug, and it's also a new technology it's messenger RNA. So it's not just your typical virus that's been killed so you can get antibodies. It actually tweaks your RNA and your DNA, and that's too much to ask.
I hear you. I actually saw, well, I started watching a video about a guy that said there's a new Supreme Court decision out that says that now because you have this DNA, this essentially patented technology inside of you, you now become quote-unquote transhuman, and now you become property of the I didn't look at it yet. The guy says, here's the link, so I'm going to look at it tonight, because but it kind of makes sense in a way. I mean, it does say it goes into your body, starts producing this other spike protein, so.
Right.
Yeah.
Which has some, there's a Nobel Peace Prize doctor that said it's, what was it, that may be causing the variant. Forget his name. Okay. Yeah, may be causing the variant itself. So, you've got, nobody should be messing with your RNA and DNA, especially experimentally. It's not proven.
Or even if you are gonna, let's say you do have to experiment, at least use a smaller population size than everybody can get your hands on. That's the craziest thing. 'Cause I think some people would do it for $100. You know what I mean? Some people are just gonna put anything.
Should be a choice.
All right.
It definitely should be a choice.
So,
you know.
Yeah. They would find volunteers, but do you want to say why you came? Or
I'm good.
Okay. That covered a lot. Thank you.
If your contact information, feel free to do so. You can take a picture of it at the end of the night, just for a way to stay connected. Some of the things that I've noticed already tonight, we've got a pharmacist here. She's like seen it all. We've got lab techs, we've got nurses, we've got MRI techs, we've got kind of everyone in the gamut. And you're not alone. I mean, we're all seeing the same worrisome things. And together, it helps the community because they don't think us healthcare clinicians are worried about this. The other thing I just wanted to mention is we do have, Jason's got me on video, I don't know if I want this. On video, you can cut this or keep it.
Oh, okay.
But we did have a surgeon who's also a DO here 2 Friday nights before. He actually works at Memorial, and he is basically like has this vision, and he's already started. He's got several other providers on board with him, but he's basically like, when this shit goes down, I don't care if I'm on my back deck helping someone with their ingrown toenail for $10. Like, I'm going to provide healthcare somehow, some way to this community and do it well and do it right. That he is looking at a full service like medical clinic that's not run by administrators who are thinking just CMS Medicare mandate. He doesn't know how it's all going to come to be. I do have a history of project management. Before I became a nurse 15 years ago, I said I'd volunteer my time to capture people's names and their skill set, their location. But he emailed me today and he's like, we're at the point where I really want to pull everyone together, like on a Zoom call or, you know, some sort of collaboration as to how do we make this vision a reality. Now, I'm not saying people are going to be on a payroll with him in a week, you know, as people are looking at, we might have to be creative for 6 months, but he's really seriously actively, and he's got a medical director, you know, for Dartmouth on board. We've got pharmacists. I mean, we've got a lot of it coming together. So if you want to be part of that, go ahead and put an asterisk next to your name and your email. And once we know the date and time and the Zoom call number, we'll add you to that. But really, this is what the community needs. They need to see more and more of us. And we all need a way to communicate what's going on and how we're going to take care of our communities, health-wise, and ourselves. So I appreciate you all being out here. We've got clinicians that are getting bullied by their supervisors and exemptions being denied, and yet we've got someone here saying there's legislation that passed a month ago. You can't be mandated to have that vaccine if you work for Concord Hospital. So part of it is just trying to keep up with the information, which we all know on social media. I mean, my brain just gets hurt. Like, I want to take a complete break this weekend, right? But at the same time, we're also in battle. When you're in battle, you might be weary, right? And you kind of have to keep working together to get through the storm. So that's where we're at. I just thank you all so much for coming. We're here Monday, Wednesday, Friday, 11 to 1. The intersection's very busy with people going to dialysis and x-ray and doctor's appointments. We get a lot of honking. And then Friday night, 5 to 8 or wherever you guys want to stay. We've got pizza on the way. And that's really to get the 5 o'clock traffic, and then anyone who's working that can't stand during the week to come stand. And we may kind of slow down here in the intersection, but the staff up there still sees us, and it still means a lot to them. And just to be out here and be able to talk with each other means a lot too. So enjoy your time tonight, and thank you for coming out. It really means a lot.